Namaste everyone, I am your Dr. Ramesh Kasarla. Today in this video we are going to explore pancreatic cancer together. During this video we will discuss its causes, symptoms, stages of the pancreatic cancers, diagnosis procedures and finally old and new treatment options. Let's begin this important journey together. Pancreas is an organ that a human lies in the abdomen, stretching from the behind of the stomach to left upper abdomen near to the spleen. In adults, it is about to the 12 to 15 centimeters long, lobulated and salmon colored appearance. Anatomically, pancreas are divided into the head, body and tail. Wider end of the pancreas is sustained in the right side of the abdomen, called as the head, and body it is the middle section of the pancreas extending the horizontally across to the abdomen. Tail it is the narrow end of the pancreas positioned on the left side of the abdomen and trapping towards to the spleen. This pancreas also having the structural parts of the ducts. Pancreas containing mainly two type of ducts. One is the pancreatic ducts, another one is common bile ducts. These ducts join together to form a ampulla water which empathizes into the duodenum. Pancreatic duct carries the digestive enzymes from the pancreas, while common bile ducts transport the bile from the liver and gallbladder. Let's look into the pancreatic functions. Pancreas are having the two main jobs in the body. One is the exocrine functions, another one is the endocrine functions. Let's see the exocrine functions. The majority of the pancreas consisting of the exocrine glands that produce the enzymes for the digestion. This exocrine system is having the acinar cells and ductal cells. Acinar cells also called as a primary secretory cells of the pancreas. These are producing the enzymes that including the protease, lipase and amylase which are involved in the breakdown of the proteins, fats and carbohydrates. And another type of cells are the ductal cells. Ductal cells lines in the pancreatic ducts and facilitate the transport of the digestive enzymes from the acinar cells. They also secrete the bicarbonate ions for the neutralizing the acidic semen from the stomach. This neutralization create the optimal environment for the pancreatic enzymes to function the small intestine. Another major function is endocrine functions. Pancreas also contain the small clusters of the cells called as the islets of the Langerhans which produce the hormones. Within these islets of the Langerhans, different type of endocrine cells are present, each with the specific hormone secreting functions. These are the alpha, beta and delta cells. Alpha cells, these cells secretes the glucagon which is a hormone that works to increase the blood sugar levels by triggering the releasing of the stored glucose from the liver. Another one is the beta cells. Beta cells produce the insulin which is the hormone crucial for the lowering the blood sugar levels by facilitating the uptake of the glucose from the bloodstream into the cells where it can be utilized for the energy production. And another type of cells are the delta cells. These cells are releases the somatostatin which is the hormones that inhibits the secretion of the both insulin and glucagon, thereby helping to the regulate the blood sugar levels. Together these coordinated actions of these hormones finally regulated the blood sugar levels and ensure the proper functioning of the metabolic process in the body. Before going into the pancreatic cancer, let's try to understand the cell development. Cell development it is having the two types, normal cell development and abnormal cell development. Normal cell development involves the growth and division of the cells to form a healthy tissue. These cells have the specific structures, functions and undergo to the controlled division of the mitosis and organize into the tissue with the specialized roles. This maintaining balance of the process is essential for the overall health and functions. Another type is abnormal cell development. It is involved in the genetic changes that transform the normal cell into the cancer cells. These cancer cells divided rapidly and uncontrollably, leading to the formation of the malignant tumors. This uncontrolled growth can result to doubling of the cancer cells and spread the cancerous cells to other parts of the body, known as a metastasis. Understanding these concept of the abnormal cell growth is crucial for the diagnosis, treatment, and preventing the cancer. Pancreatic cancer is a malignancy that starts in the pancreas located behind the stomach. Its results to form a abnormal cell growth. Frequently, it is diagnosed late and it is leading to the unfavorable prognosis. Pancreatic cancer is mainly classified into the two types. One is the exocrine pancreatic cancer, another one is the endocrine pancreatic cancer. Let's see about the exocrine pancreatic cancer. This type accounts for the vast majority of the pancreatic cancer causes arising from the cells that line the pancreatic ducts. The most common form of the exocrine pancreatic cancer is pancreatic ductal adenocarcinoma. Second one is the endocrine pancreatic cancers. This is also called as the neuroendocrine tumors or isolate cell tumors. These cancers develop from the pancreatic cells that produce the hormones such as insulin and glucagon. Endocrine pancreatic cancer is less common than exocrine pancreatic cancer. Until now, we know about the pancreatic cancer and types. Let's see what are the causes and risk factors of the pancreatic cancer. First one is the smoking. Smoking is one of the most significant risk factor for pancreatic cancer. Cigarette smoke contains the carcinogens that can damage the DNA of the pancreatic cells, leading to the development of the carcinogenous growth. And another one is the carrying the excessive of weight. Being the overweight or obese increase the risk of developing the pancreatic cancers. Excess body fat, particularly around the abdomen, can cause the inflammation and insulin resistance, which are associated with the increased risk of the cancer development. Another important one is the personal history of the diabetes. Individuals with the history of the diabetes, especially type 2 diabetes, have the higher risk of the pancreatic cancers. The exact relationship between the diabetes and pancreatic cancer is not fully understood, but it is believed that insulin resistance and high blood sugar levels may contribute the cancer growth. And other one is the chronic pancreatitis. Chronic pancreatitis, inflammation of the pancreas, known as the chronic pancreatitis. It is a significant risk factor for the pancreatic cancers. Over the time, ongoing inflammation can cause the damage to the pancreas cells and increase the risk of the malignant transformation. Another important factor is family history. Having family history of pancreatic cancer or pancreatitis can also elevate the risk of developing the pancreatic cancers. Inherited genetic mutations associated with the familial pancreatic cancer syndromes such as hereditary pancreatitis or Leach syndrome can predispose the individual to the disease. Understanding these risk factors can help individuals to make informed life cycle choices and undergoing to the appropriate screening measures for the early detection and prevention of the pancreatic cancers. Additionally, genetic counseling may be beneficial for the individuals with the family history of the pancreatic cancers to assess their risk and explore the preventive strategies. Next step is pancreatic cancer signs and symptoms. First one is the abdominal pain. Dull or sharp pain in the upper abdomen or backside. Often persistency or worsening, it is over time. Another one is the jaundice. Yellowing of the skin and eyes due to the blockage of the bile duct by the tumor, leading to the bile buildup in the bloodstream. Other signs and symptoms are unexpected weight loss, loss of appetite, and digestive problems. Let's look into the unexpected weight loss. It is a significant and unintended weight loss despite the normal eating habits happen due to the cancer impact on the metabolism. Loss of appetite, decrease the desire to eat, accompanied by the nausea and vomiting, which can be contribute to the weight loss. And final one is the digestive problems, such as the diarrhea, oily stools, or changes in the bowel habits. resulting from the inadequate pancreatic enzymes productions affecting on the digestion. Recognizing these signs and symptoms can be aid in the early detection and prompt the medical evaluation for the possible pancreatic cancers. If you see these signs and symptoms, please consult the doctor for better understanding. In some cases, other health problems also affecting on the same symptoms. So don't conclude easily it is the pancreatic cancer. Now we can see the stages of the cancer. First one is the stage 0. Pancreatic cancer, also known as a carcinoma in situ, it is involved in the presence of the abdominal cells in the lining of the pancreas. While these cells have the potential to become a cancerous, but they have not yet invaded nearby the normal tissue or spread to the other parts of the body. Early detection of these stage 0 pancreatic cancers, early detection and intervention are key factors for the preventing further progression of this disease. After stage 0, pancreatic cancer will enter into the stage 1A. During this stage, pancreatic cancer refers to localized from the disease where the tumors is small, measuring the 2 centimeters or smaller than the size. At this stage 1A, pancreatic cancer is confined to the pancreas, but it has not spread to the nearby the lymph nodes or other organs. Next stage is the 1B, pancreatic cancers. This stage indicates that tumor is larger than the 2 centimeters but not larger than 4 centimeters. It is similar to the stage 1A cancer at this stage, confined to the pancreas and has not spread to the nearby the lymph nodes or distant organs. Proper diagnosis and treatment is essential for this stage 1 cancers is good to improving the prognosis. Next stage is the stage 2A. Pancreatic cancer is characterized by the tumor has grown larger and measuring more than the 4 centimeters in size. At this stage 2A, this cancer may have the extended behind the pancreas to nearby the tissues or organs such as the duodenum, bile duct, and nearby the lymph nodes. However, it has not spread to the distant site in the body. Next stage is stage 2B. Pancreatic cancer stage 2B is characterized by the tumor of any size, has spread to the 1 to 3 nearby the lymph nodes but has not yet metastasized into the other organs in the body. At this stage, cancer may have involved in the nearby tissues and organs such as the duodenum and bile duct. For this stage 2 cancer, we are having the treatment options typically involved in the combinations of the surgery, chemotherapy, radiation therapy, with the aim of the controlling the cancers, improving the patient's outcome. If we neglect the symptoms and we didn't diagnose the pancreatic cancers in the first 2 stages, the tumor will continuously grow and it will enter into the stage 3 pancreatic cancers. At this stage, cancer that has spread behind the pancreas and nearby the lymph nodes. There is a two scenarios in the stage 3 pancreatic cancers. First one is the tumor is any size and cancer has spread to 4 or more nearby the lymph nodes. And second one is that the tumor is any size and cancer has invaded the major blood vessels near to the pancreas such as the portal vein and common hepatic artery, celiac axis or superior mesenteric artery. At this stage, cancer is in the advanced locally and may be challenging to treat. But we are having the treatment options may include the combinations of the surgery, chemotherapy or radiation therapy aimed to controlling the cancer and managing the symptoms. However, prognosis at this stage of 3 pancreatic cancer is typically poorer compared to the earlier stages, highlighting the this is highlighting the importance of the early detection of intervention. Final stage of the pancreatic cancer is stage 4 pancreatic cancers. This is the most advanced stage and cancer is spread behind the pancreas and nearby the lymph nodes to distant parts of the body. Tumor can be any size and cancerous cells affecting the organs like lungs, liver, and peritoneal cavity. Treatment options for this stage, such as the chemotherapy and targeted therapy, aim to manage the symptoms and improve the quality of life. However, the prognosis is generally poor and early detection is crucial for better outcome. Despite the treatment effects of the stage 4 pancreatic cancers remain challenging to manage due to its advanced nature. We know what is the pancreatic cancer and what are the types and what are the stages of the pancreatic cancers. Let's try to diagnose it. Pancreatic cancer diagnosis is typically involves in the combinations of the imaging test and procedures to confirm the presence of the cancers and determine its stage. Here there are the some common diagnosis methods I discussed. First one is the MRI. It is also called as the magnetic resonance imaging. This imaging technique uses the powerful magnets and radio waves to create the detailed image of the pancreas and surrounding the tissues. It can help to detect the tumor and determine their size and location. Other diagnosis procedure is CT scan. It is also called as a computed tomography. CT scan used the X-rays to produce the cross-sectional images of the pancreas and other abdominal organs. They are often used to detect the pancreatic tumors, assess their size and spread, and identify the involvement of nearby blood vessels. Next method is positron emission tomography, also known as a PET scan. PET scan involves in the injecting the radioactive traces to the body which absorbed by the cancer cells. By the helping of these radioactive traces, PET scan detect the areas of increasing the metabolic activity and helping to the identify the cancerous lesions and detect any spread to the other organs. Next test is the laparoscopy. This is minimally invasive surgical procedures involves inserting the thin flexible tube with a camera through a small incision in the abdomen. It allows two doctors directly visualize the pancreas and surrounding the tissues, take the samples for biopsy and assess the extent of the cancer spread. Next one is the abdominal ultrasound. Ultrasound uses two high frequency sound waves to create the images of the pancreas and surrounded organs. It can help to detect the tumors, assess their size, and identify the any abnormalities in the pancreas or nearby structures. Final diagnosis test is biopsy. During this procedure, they used to collect the small tissue samples from the pancreas for the examinations. This can be done by the methods like fine needle aspirations or endoscopic ultrasound guided biopsy or laparoscopy or surgical biopsy. These biopsies confirm the cancer's presence and determine the type and guide the treatment decisions by the examining the tissues for the cancerous cells and genetic mutations. There is also another procedure, liquid biopsy. During this procedure, they used to collect the blood samples and they used to check the circulatory tumor cancer cells. These all diagnosis tests are more i- important because early diagnosis of the pancreatic cancers having the higher chances of the prognosis. Now important part is treatment of the pancreatic cancers. Pancreatic cancer treatment methods aim to control the growth and spread of the cancer cells and improve the patient quality of life. Here, the main treatment approaches I discussed. First one is the surgery. Surgical removal of the tumor is often recommended for the localized pancreatic cancers in the stage 1 and stage 2. If tumor is operatable and patient is in the good health, they use the different surgical procedures may be performed, including the Whipple procedures or the distal pancreatectomy. Next one is the radiation therapy. Radiation therapy uses the high energy beams to target the destroy the cancer cells and it may be used before the surgery, like neoadjuvant radiation therapy to shrink the tumors, or after the surgery adjuvant radiation therapy to kill the any remaining cancer cells are present in the body. Another treatment option is chemotherapy. Chemotherapy involves the use of the drugs to kill the cancer cells and stop their growth. Common chemotherapy drugs used for the pancreatic cancers include the cepicetabine, fluorouracil, and leucovorin and oxaliplatin. Chemotherapy can be administered before the surgery to shrink the tumor, or after the surgery to kill the remaining cancer cells, or palliative treatment to relieve the symptoms and improve the quality of life. Until now, we discussed about the main treatment options of the pancreatic cancers. Now, in the markets, we are having the new treatment methods under the clinical trials. In that one, first one is the immunotherapy. Immunotherapy drugs works by the boosting the body to immune system to recognize and attack the cancer cells. While it is still in the clinical trials for the pancreatic cancers, immunotherapy shows the promise as a potential treatment option. Next new treatment option is precision medicine. Precision medicine involves tailoring treatment based on specific genetic characteristics of the tumors. This is a targeted therapist can be used to attack the cancer cells more precisely and potentially improving the treatment effectiveness and reducing the side effects. Another new treatment option is nanotechnology. Nanotechnology involves the uses of tiny particles, also called as the nanoparticles, to deliver the drugs directly to the cancer cells and minimizing the damage of the healthy tissues. This approach may enhance the effectiveness of the chemotherapy and reduce the side effects. These all new treatment methods offer the hope for the improved outcome and quality of life for the pancreatic cancer patients. However, further research is needed to determine their effectiveness and safety in the clinical practice. Let's recall the today's lesson. Pancreatic cancer is a complex disease with the various causes including the smoking, obesity, and family history. Symptoms such as the abdominal pain, jaundice, unexpected weight loss. These stages of the pancreatic cancer is stage 1, stage 2, and stage 3, stage 4. Diagnosis methods are the MRI and CT scans as well as biopsies. Treatment options include the surgery, radiation therapy, and chemotherapy. New treatment options in clinical trials are immunotherapy, precision medicine, and nanotechnology. Early detection is critical for the better outcomes as a pancreatic cancer is often diagnosis late, it is leading to the poor prognosis. Thank you for tuning into this video. I trust this information provided has been beneficial. For more details, please check out my channel Dr. Ramesh Kasarla. Your feedback and suggestions are always welcome in the comment section. Once again, thank you for watching. Dhanyavad. Be healthy.